What is coronavirus? A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Most coronavirus are not dangerous. But in early January 2020, the World Health Organization identified a new type, 2019 novel coronavirus 2019 nCoV, in China. They get their name from their crown-like shape. Sometimes, but not often, a coronavirus can infect both animals and humans. Symptoms. People who have been diagnosed with the virus tend to have a fever and cough, and some have difficulty breathing. The symptoms appear to set in at some point between 2 days and 2 weeks after the person has been exposed to the virus, according to health authorities. Cure. There is no absolute cure for coronavirus till now. But other antibiotics can be used to fight coronavirus at larger extent. Precautions. Most coronavirus spread the same way other cold-causing viruses do, through infected people coughing and sneezing, by touching an infected person's hands or face, or by touching things such as doorknobs that infected people have touched. Avoid outside food, use face masks, avoid physical contact with strangers, and eat cooked food. Where did the virus come from? The World Health Organization told journalists this week that the agency is still working to pin down the source of the virus. But many of the first confirmed cases were in people who had visited a food market in Wuhan. The market, which sells live farmed and wild animals, has since been closed and disinfected. A recent genetic analysis suggests that the virus resembles viruses that infect bats and snakes. Researchers believe that it may have resulted from separate viruses in bats and snakes recombining. This could have happened in the wild, but may also have occurred in the market, where the animals have been kept in close proximity to each other. Where has the virus spread to so far? Most of the confirmed cases have been in Wuhan, where at least 444 people are known to have been diagnosed with the virus. But many more cases have been confirmed in China, including in Beijing, Shanghai and Guangdong. In total, there are more than 600 confirmed cases in China alone. But the virus has also spread internationally. Cases have been confirmed in Thailand, Japan, South Korea, the US and most recently Singapore and Vietnam. So far, all these confirmed cases are in people who have traveled from China. But hundreds of suspected cases are being investigated in countries across Asia, as well as the UK and Mexico. How deadly is it? So far, 36 deaths have been linked to the virus, which suggests a low to moderate fatality rate of around 5 to 6%. Most people feel this is somewhere on a spectrum between a relatively mild infection and SARS, which had a very high case fatality rate, says Mark Woolhouse at the University of Edinburgh, UK. Again, it is too soon to be sure. There are concerns that the virus could mutate and become more dangerous. Patients are in strict observation. Read more recent condition on our blog. Link in description below. Like, share and subscribe.